The Wellness Collaborative was founded because it is all connected and it's never one thing. We are meeting monthly so that we can see different perspectives from other disciplines and really learn from each other, inspire and empower each other and our patients, because that's really what it's about.
I'm Dustin Hawken, and I have a very special guest today, Dr. Mackenzie Jones, owner and founder of Breakthrough Functional Medicine. Dr. Jones, welcome to the show.
Yeah, thanks for having me. It's great.
Yeah, appreciate
Excited
it.
to be here.
So I'd love to hear, and I'm sure our listeners would love to hear your journey into starting this business and how it's been.
Yeah, sure. It kind of starts back in my childhood, so I kind of briefly talk about that. But I was really sick growing up. I had a bunch of allergies, a bunch of medications, asthma. It was pretty much every time I went to the doctor, oh, here, take this. We don't really know how to help you. I was just one of those people that kind of fell through the cracks, I feel like, of the medical system. So by the time I was, I think it was 16, I was on 7 different prescriptions and, slept all day, bad acne. I mean, the list goes on and on. So then kind of my breaking point was I came here to UNCW. I always knew I wanted to be a nurse. My mom's a nurse, my grandma's a nurse, so I always joke it's in the genes. Kind of got really sick like that fall semester, got diagnosed with ulcerative colitis. So I was on all these antibiotics, all these prescriptions. Back then they were giving out opioids like it was candy. It was crazy. And so I called my mom and I'm like, hey, I can't even get off my top bunk of my dorm room. So she comes and gets me and she's like, we got to do something, right? Like, you can't live like this. So she's like, I've heard about this, we call him a hippie doctor in town, holistic doctor. And he helped one of her friend's daughters, I guess. So she's like, this is kind of like our last ditch effort. That's what we're going to do. So I go see him. He takes one look at me and he's like, you're eating foods you're reactive to. You have hypothyroidism. And so within 2 weeks, I'd made some diet changes, started taking some supplements, some medications, and was like a completely different person. And so I said, that's what I'm going to do with my life.
Wow.
Yeah.
How was he able to find that out? What was going on with you?
He just did a really good physical assessment. I mean, I remember it was the randomest things. He'd oh, you see your moons of your nails, you're malnourished. I mean, I think he just used his diagnostic skills. And then I think he did some labs too, if I remember correctly. And so I had antibodies and just no one had checked that. They would say, oh, you're 18 years old, you're fine. You just need some more X, Y, and Z prescription. So he really looked at everything and kind of used a holistic, that's why I like functional medicine, because we still use medications when needed. He gave me a thyroid prescription, right? But then he was working on the, holistic side of things too, like supplements and diet and lifestyle, things like that. So yeah.
And so you feel like it was just a few weeks and you were feeling better?
I mean, looking back when I was wow, I slept 12 hours a day and I was just oh, I'm a college student. I'm tired. It's normal. I didn't realize how much joint pain I had. Just walking upstairs would be difficult for me. It's you don't realize how bad you feel until you start feeling better. And I was wow, I really was not doing well. And I have a lot of patients tell me that too. It's almost you forget how sick and how bad it was, right? And especially in today's culture, it's kind of keep going, push through, you're okay, you're just tired, you're just depressed, whatever. Yeah.
So after you started feeling good, so now you knew that this was what you wanted to do.
So it was my journey.
Your journey. So then what was the next step there? You went to UNCW, nursing.
Yep, and then graduated nursing in 2000, because it was 13, and then worked a few years, went back to nurse practitioner school. It was good. I still got that traditional training, in learning. So I think that's needed. We need to know if someone's acutely ill, oh, you're having a gallbladder attack or you're having a heart attack or, anything like that. We need to know those things. So I never poo-poo traditional medicine. Traditional medicine has its time and place for sure. But then I took it a step further after I graduated and went and got, getting certified in functional medicine, which is more root cause medicine, trying to find, why do you have irritable bowel syndrome, right? Is it something you're eating, something you're reactive to? Do you have inflammation in your gut? Trying to work on more things like that than just oh, you have IBS. Sorry,
So now you have your business, pushing a year now. So tell me how that's been growing the practice and what you've been seeing in your business.
I've really set up my practice so that people have the space and the time to, we just sit together and I hear their whole history and their backstory, because it's super important, I think, to hear, was there traumas? Were you exposed to a toxin? Just trying to I always kind of joke, peel the layers of the onion, what's there. and just really giving people space and time to be heard. I think a lot of times, in traditional medicine, it's just so fast paced because we have to see, 20, 30, 40 patients a day. I've been there. I worked in urgent care. I worked in psychiatry. I've been there. So I understand. But setting up my practice where people have that space and time to be heard, and then really working at it in like a step-by-step fashion. When I did functional medicine, I just saw where people were getting overwhelmed because it was like, change your sleep habits, change your diet, change your exercise. So I've really tried to give people the knowledge and be empowered, but also say, okay, let's work on this one thing right now, and then it's not so overwhelming. And a lot of times I think functional medicine gets a bad rap on people have to take all these supplements. And I do think, supplements are needed. There's a time and a place. But how can we do the free medicine, is what I like to say, like get some sunshine and work on stress management and get some exercise, so we hopefully don't have to take so many supplements. Because I got to the point where I was taking like 20, 30 supplements, and I'm like, I can't do this financially, or my stomach can't handle that.
Yeah, for sure.
Yeah.
My grandma, she always used to say, whenever you take something, there's always going to be an adverse reaction to it.
Yeah,
so just
exactly.
be careful for all the things that you take. And,
Yeah.
And a lot of
they all
times
work
it's
together.
years after.
Yeah.
And then all of a sudden you're like, whoa, this is going on. Or,
Yeah.
So I'm sure you've seen a lot of that with yourself, but then also with a lot of patients too.
Right. Yeah. So it's like, hey, fish oil is awesome, but can we work on eating some salmon in your diet? Or like, how can we kind of meet that halfway? And so you don't have to hopefully maybe take a supplement forever. Some people I'm like, hey, we're inside all day. We don't get enough sun. So you might have to take vitamin D forever. You know what I mean? Right. It's not like we're our ancestors where we were literally outside all day long, so it's things like that where I'm like, okay, culturally, society wise, that might be something that just is what it is, but we can try.
So talk to me a little bit about your process a little. So you talked about how a traditional hospital, you're seeing 20 people a day.
Right.
So what does it look like when someone comes in to see you for the first time?
Yeah, good question, because I've set up my practice so it's very unique compared to most functional medicine doctors. And I think I just got to see in my own functional medicine journey, seeing providers how it was almost feeling rushed, like back to that traditional model. And I just really didn't want patients to feel like that, because I know what it feels like too, right, to be in there. So the first step of my practice, this is optional, but it's a discovery call. So it's really just getting to see if we'd be a good fit, right? Like I've had some patients call and like, for example, they're 45 and they want to have fertility, like become pregnant. And I'm like, yeah, that's not my specialty, so I just want to be upfront with people and just be like, yeah, I think we would be a good fit. Or no, like I don't think this makes sense, but like here's another resource, or here's someone else. So I always try and leave people with here's a next step, and if it's not me, that's okay, right? Like I just want to help people where they're at. So that's the discovery call, and it's either a phone call or a Zoom call, and it's $50 for 30 minutes. So that's the first optional step. And then some people, I've been very surprised. A lot of people are just like, no, I know I need help, and they just kind of skip that step. And then the next step is a foundational assessment. So actually, when they sign up, it's onboarding first. So it is a pretty lengthy intake form. So it's medical history, surgical history. What are your symptoms? What have you tried? What have you not tried? What are your goals? I think a lot of times I've learned that I would be like, oh, I'm going to go in with this patient. We're going to work on this. We're going to talk about this. Well, in the long run, it's their, it's their story, their life. I'm going to focus on your goals, right? Because you're the patient. I'm just helping you. So that foundational assessment, it's a 90-minute assessment. I was like, sometimes I go over, but usually 90 minutes. And it's really giving that person time to talk about their history. We do a physical exam, vital signs, and then this is where I talk about the free medicine. So that's why it's called foundational assessment, because we want to talk about what's your sleep habits, what's your sleep hygiene, what are you eating, right? I think a lot of people actually aren't eating enough. Like we're maybe having our coffee, having a croissant, and then not eating again until dinner, So I'm really trying to get people to make sure they're eating enough protein, enough fats, enough actually carbs throughout the day. And then talking about exercise. I think some people don't even ever take days off, and it's like, hey, your body needs time to rest. Like just go for a walk, or something like that. And then we talk about stress. I think everyone's just so stressed, and I know it's hard because that's culture. But just trying to find that space of like, can we just breathe for 5 minutes? Can we do a meditative app before bed? Just trying to find that space. And then we go through labs. and I don't know if you know this, in traditional medicine, there's a reference range like on the lab paperwork where it's like, this is 95% of the population. If you were, above or below, you're deficient, and then that's when they diagnose you, right? In functional medicine, we really want you to be optimal. So for example, if your blood sugar is 99, then you're technically normal. Like the reference range is 70 to 100. So 99, oh, you're good. You're not out of the range yet, right? But if, I'm like, hey,
you're so far over there.
Yeah, you're like 1 point away from being over. So then we're like, hey, like how can we work on blood sugar control? What diet changes can we make? Or, okay, you can't change your diet right now. Well, should we do a supplement instead? That kind of thing. So yeah, so that's the foundational assessment. And then the next step, people can come do that foundational assessment once a year. And then after that, I work in like a membership. So if you want to continue to work with me, it's a monthly, almost like a gym membership. And then they're working with me for 12 months. Just, a lot of patients I would see, like, they'd be like, okay, I'm going to come see you in 2 months, right? Like in my other model I was in. And then they'd be like, oh, I didn't do anything you told me. So, I'll see you in 6 months. And then they're even worse than they were. So I really want people to be like, I'm holding you accountable. You're holding me accountable. We're kind of walking this journey out together.
And I think the monthly, that's a good structure to do it, because a coach is always good, whether it's a business coach or a sports coach or a health coach in this situation. And to have someone, like you said, checking in on you in the back of the patient's mind, it's like, gosh, should I really eat that candy bar right now? I only have 2 weeks, and then I have to go see Dr. Jones. I better not have that. And so little things to hold people accountable is great. So what does the pricing look like for the monthly membership?
Yep, so it's $249, and that includes 6 visits with me, so it's pretty much every 2 months. 3 visits with the health coach, so about every second visit, I guess, with me. And then I'm also going to have education classes. Those start September 11th, and they're free for members. People can join. It's $50 virtually, but I really want to have that safe space for my members to say, hey, I'm going to teach about like this upcoming month's on gut health. So I'm just going to kind of give an overview. So hopefully people have that knowledge when they come to see me for the follow-up appointments of like, oh yeah, I remember you saying that, but like, what specifically for myself do I need to do, right? Like I want them to be educated and have that kind of foundation. And then every month, I'll speak like every other month, and then have someone come guest speak. So then, like Casey Jones, who's here, does a lot of breathing, retraining. And so having like her come speak on something that I'm not well-versed in. They can message me, right? Like I think a lot of times people are like, I can't get a hold of my provider. They won't call me back. They won't answer. And I'm like, if you're a member, I will respond within 24 to 48 hours. Promise. Yeah.
Well, and it makes sense because a normal doctor, they're seeing, again, 20 people a day. Like,
right.
How
like
are
I've
they,
been there. I understand.
Yeah, how are they going to have time?
Right.
They just they don't have the time.
Yeah.
With your practice, what are the most common things that you're seeing with people? So you mentioned working out too much or maybe not eating enough. What are some of the other things that potentially some of our viewers might be having issues with?
Yeah, I think a lot of people are just coming in, they're just burnt out. They're like, I'm so tired. I wake up, I'm tired. I need to take an afternoon nap. And then at night, I'm like wired and like ready to go, right? So that is called adrenal, it's not adrenal fatigue is what we call it, but it's really like you've just burnt yourself out, right? Like your cortisol is just crazy. It's low during the day, high at night, just from chronic stress. And so just really trying to meet people there and say, can we wake up in the morning and you can't believe what just sunshine would do. Like just watching the sun come up, it's kind of resetting that circadian rhythm, and then it releases melatonin actually at nighttime. So that morning you're actually working on your sleep that night, which is kind of cool. So, and then just like, hey, let's like for 5 minutes, let's do some deep breathing, maybe like gratitude journaling. If you are, when you're grateful, there's no room to be negative, right? Because you're like, oh, I have this, instead of, I think a lot of times our thought patterns, like we can be very negative, and it's crazy how that can make us actually sick with like, oh, I'm overweight, I'm tired again, and then we're telling our bodies that, and sometimes, those things are real, but we have to check in with our mindset too.
It's like Eeyore.
I know.
And Winnie the Pooh, Eeyore.
Yeah, I'm going to start speaking that now. Yeah.
So what do you think about going back to sleep and the type of sleep? What do you think about some of those different, sleep trainers like the Whoop? Or things.
Funny, I just had a patient who was like, the Whoop really it's pretty cool. She was showing me her sleep pattern, I'm like, okay, it's decent, but you're not sleeping throughout the night. She was getting up a lot. So then we started talking about, okay, what are some things we can do? And something as simple as putting on like blue light blockers. So, think about our ancestors, right? When the sun came up, they woke up, and when the sun was going down, they went to sleep, right? Well, us were like, okay, maybe we'll stay inside until noon or whatnot. And then, oh, I'm going to go at 9 o'clock, start watching some TV, which is that bright light. So our brains are like, I'm confused. Is it the daytime or is it the nighttime, right? And then it's not releasing that melatonin because when it sees the sun going down, it's going to release that. So putting on those blue light blockers will kind of tell your brain, oh, okay, so it is dark and I do need to start getting ready for bed.
So in terms of people working with you, what is the vision of how long will they always be a client?
Yeah, I think, if someone does the membership, we just kind of check in at 12 months and say, have you met all your goals? Are you where you want to be? I mean, I have some patients, like I see at the foundational assessment, and I'm like, look, you're really pretty good. Like you're doing all the things. I think you just need a few tweakings, with the with your supplements or lifestyle stuff. But and I'm usually pretty honest. Or some people I'm like, hey, like you're a hot mess. Like you need this membership.
Yeah.
But yeah, I think everyone can always improve their health. So it's hard for me to be like, oh, you don't need the membership. I'm kind of like, I think we could discover things. There's always detoxing you can do, or cleaning up your environment, or other things you can do. But yeah, just checking in if they do the membership at 12 months and saying, okay, what are next steps? And so yeah, I think I'll kind of just play it on a like a play-by-play, like just like, hey, how are you doing? Should we go to every 4 months, every 6 months? Should we just check in once a year? Just kind of do it per patient, to see like how they're feeling.
What do you feel like are some of the most interesting things that you've learned so far since starting your business?
Patients want to be heard. I mean, I just try and really give people that space of just like, this is your story. I want to hear about it, and anything you want to tell me or don't want to tell me. And I think a lot of people have almost like medical trauma from just the like, doctors don't have time. They walk in, they're like, what do you need? What do you want? And it can be very, like they're very discredited and like, oh, you're not, you don't have anything wrong with you. You're just depressed. And they're like, well, no, I'm depressed because I don't feel good.
Yeah.
So yeah, just really trying to give that space and just, I think, meet people where they are too. I'm such like a type A, like I always say, recovering perfectionist, and just being like, oh, well, you could do this, you could do this. Instead, just trying to really be like, okay, what do you think would be best for you? Because I have all this knowledge and like thoughts and ideas in the back of my head, but what would be most serving and beneficial to you? And and they're the ultimate, patient. They're the patient. They're gonna, know what's best for them, and I'll just give them the guidance. Yeah.
And at the end of the day, they're going to do what they want.
Right.
And so you really have to help them
Yep.
figure out the answer for themselves.
Exactly. So I'm like, hey, change your diet. And the person's like, I'm not going to do that.
No.
And you're like, okay. So
Right.
what's next? Do you want to work on something else? That kind of thing. Yeah. So it's been cool.
So as we wrap, is there anything in particular you think that our viewers should know?
So if anyone's out there who's like, I cannot, figure out what's going on. I've been to all these doctors. They just don't have answers for me. I always feel like that's where patients find me, is they've kind of, I'm like their last ditch effort, kind of like I was when I found the functional doctor.
It's exactly like your story.
Yeah. So just saying like, I will listen. I promise I will find something wrong with you. I'm just kidding. But like really, I will say, oh, your labs could be optimal or could be better. So people always leave with a lot of information. I think sometimes maybe too much, but I want to give them that overview, especially at the foundational assessment of like, here's your labs, here's all the things I've found, and then here's some like targeted approaches, of what you can do. So yeah, so I just think I just try and give people the knowledge and answers, and then just space.
So you talked about free things that people can do. What are the top few things that you see that people aren't doing that they should be doing?
The hippiest thing I can say, I'm just kidding, is so right in the morning when the sun's coming up, just go outside, just get into nature, take your shoes off, put your feet in the ground. It really is, that they call it grounding. There's a ton of research on it actually too. There's the electromagnetic field from the ground, actually, crazy enough. So yeah, really good, like really grounding. Just take some good deep breaths, maybe some gratitude journaling. Just really be like present and be like, okay, today's a new day. all about, mindset too, just really speaking positive words over yourself too. So that's a good place to start. Trying to think what else. Yeah, and honestly, our cells are made from oxygen, and people just don't breathe enough. I mean, we're all like shallow breathing, right? Because I always joke we're either in fight or flight, which is sympathetic, or parasympathetic. And a lot of us are always in fight or flight, like we're being chased by a bear, right? So back in caveman days, it was like you're either running for your life or you're chilling, and for a lot of us, we just have chronic low stress all the time. So I really encourage like a rest day, like a Sabbath, if you will, where you just take a day off. And people like literally are like, what did you say? I'm like, do nothing. And they're like, what do you mean? And I'm like, don't do a dish. Don't do any laundry. Do whatever brings you joy, what's going to fill you up, and do that. And that's free medicine right there,
Even one day a week, just resetting your body.
People think I'm crazy. They're like, I can't do that. And I'm like, okay, what about like 2 hours? I can't do that either. So then we'll work on 1 hour, so it's just like those baby steps too. Yeah.
What do you find that people don't know about functional medicine, or maybe that they think they know about functional medicine, but it's not true?
Probably that we're just as bad as traditional, just throwing medicines, but instead supplements at people. So that's why I've really tried to structure my practice on the free medicine, and let's talk about, things you can just do in your everyday life, and then maybe some supplements on top of that. But that's not like, that doesn't have to happen. I think a lot of people get burned out with functional medicine because they come to me with a bag of supplements, like 20 supplements, and it's like, that's not sustainable. So I try and, say like, okay, you went to this doctor, and that's what they're known for, is just take all these supplements. That's the only way I know to treat you. So I'm really trying to say, what can we do that's free first, and work on those lifestyle things, in tandem with that.
What are the most common supplements you generally see people are lacking?
Yeah, for sure. So a lot of times vitamin D, just because we're inside a lot more. So the optimal range of vitamin D is anywhere from like 50 to 70. And that reference range we talked about earlier with what's quote unquote normal, right? 95% of the population is 30 to 100. So that's a really big range, right? We want people kind of towards the upper end, around 50 or 70. It's great for immune health, great for gut health, really just so many things. And then a lot of times I find pretty much, I'd say probably 80% of people are magnesium deficient. So when we get stressed, our magnesium gets depleted, and that leads us to feeling like already more tense. It can lead to constipation. It can lead to muscle cramps, muscle twitching. So anyone with any of those symptoms, and I check their blood, lab work too. A lot of times they'll have their serum checked, like in their labs, right? So that's just what's in the bloodstream. I'm checking the red blood cell. So that's a more like a further step of, are you really deficient compared to serum? So serum can say, oh yeah, you had a leafy green yesterday. Your magnesium's fine, right? You have magnesium from that leafy green, but what's your overall status of magnesium? So people love me when I put them on magnesium usually, because they're like, I was so stressed and wigged out and anxious and couldn't sleep and took some magnesium, and now you're a genius. And I'm like, okay.
Wow.
Magnesium's probably my favorite supplement.
Wow. So vitamin D, so if you can talk a little about that. So let's say I'm going to come see you, and the day before I come see you, I'm outside all day. And then I come see you. Is my vitamin D level going to look really good?
It could.
Or does it take a long time being consistently outside?
Right. And a lot of people are already taking supplements. And so if you take your supplement, get your lab work drawn, like say you take it the day before, get your labs drawn the next day, it might still be from what you took the day before, right? So I tell people to take, if they can, 2 days off before their labs, just to give us like a baseline of where they're at. A lot of people are excited. They're like, I'm not gonna take my supplements for like a week and kind of see like, what I actually need. And then, from the sunshine's perspective, I'm assuming if you've been inside all the time and then you went outside once, it's probably not gonna, be where we want it to be, if I had to assume.
It's not gonna take you where you want to go.
I mean, it's better than nothing.
Yeah.
Yep.
Dr. Jones, it's been a pleasure having you on the show.
Thank you guys.
Thank you for your time. And for everyone that's watching, hope that was helpful. $50 for Discovery. It's pretty much a no-brainer. It's not a lot of money, especially when it's your health. So important. Thanks to everyone who watched the video. And if you want to reach out to Dr. Jones, it's www.breakthroughfunctional.com. Thanks. See you soon.